Voriconazole. Class of the drug: antifungal. Indications: it's used to treat invasive fungal infections that are generally seen in patients who are immunocompromised. Trade name: Vicanazole 200 mg, Veron 200 mg, Vifnet 50 mg and 200 mg. Available dosage form in KAUH 200 mg film coated tablets and 200 mg vial. Dosing in pediatrics: general dosing in susceptible infection, infant and children less than 2 years, IV, initial 9 mg per kilogram per dose every 12 hours, followed by monitoring of serum trough concentration, typically initiated after 3 to 5 days. Adjust dose to achieve a targeted trough. Median final dosage 31.5 mg per kilogram per day, divided every 12 hours. Children 2 to less than 12 years. Loading dosage: IV 9 mg per kilogram per dose every 12 hours for 2 doses on day 1. Maintenance dose: IV 8 mg per kilogram per dose every 12 hours. Children older than 12 years and adolescent less than 14 years, IV. If weight less than 50 kg, loading dose 9 mg per kilogram per dose every 12 hours for 2 doses, followed by maintenance dose of 4 to 8 mg per kilogram per dose every 12 hours. If weight more than 50 kg, loading dose 6 mg per kilogram per dose every 12 hours for 2 doses, followed by maintenance dose of 3 to 4 mg per kilogram per dose every 12 hours. Adolescent, if older than 15 years, IV, loading dose 6 mg per kilogram per dose every 12 hours for 2 doses, followed by maintenance dose of 3 to 4 mg per kilogram per dose every 12 hours. Adverse reaction for voriconazole: may cause hypertension, skin rash, hyperkalemia or hypokalemia, abdominal pain, diarrhea, nausea, vomiting, hyperbilirubinemia, increased liver enzyme, visual disturbance, increased serum creatinine, epistaxis, and fever. Preparation for administration: parenteral, reconstitute 200 mg vial with 19 ml of sterile water for injection, resulting in concentration of 10 mg per ml. Use of automated syringe during reconstitution is not recommended. IV infusion: further dilute reconstituted solution with normal saline, dextrose 5 water, lactate ringer, and lactate ringer with dextrose 5 water, 0.45 normal saline, dextrose 5 water and normal saline, dextrose 5 water with KCl 20 milliequivalent per liter, half normal saline, or dextrose 5 water with normal saline to final concentration of less than 5 mg per milli. Don't dilute with 4.2% sodium bicarbonate infusion. Intravitreal: dilute with normal saline or sterile water to final concentration of 100 mcg per 0.1 ml. Administration: parenteral, IV infusion. Don't administration IV push. Voriconazole must be administration by IV infusion at rate not to exceed 3 mg per kilogram per hour. Don't infuse concomitantly into same line or cannula with other drug infusions, include TPN. Intravitreal: administration of extemporaneously prepared solution of 100 mcg per 0.1 ml of voriconazole in sterile water or normal saline intravitreally. Storage and stability. Powder for injection. Store vials between 15 Celsius to 30 Celsius. Reconstituted solution are stable for up to 24 hours under refrigeration at 2 Celsius to 8 Celsius. Monitoring parameters. Hepatic functions, serum electrolyte, periodic renal function test, monitor visual acuity, color perception if treatment courses continue more than 28 days, ECG in select patient, pancreatic function in patient at risk of acute pancreatitis, voriconazole at rough level, phototoxic reactions. Drug interaction. There are many drug interactions with voriconazole and other drugs, such as with betamethasone. The voriconazole may increase the serum concentration of betamethasone, and with budesonides may increase the serum concentration of budesonides. So avoid concomitant use with it. Clarithromycin with voriconazoles. Voriconazole may increase the serum concentration of clarithromycin and colchicine. In this table, there are interaction drug category for voriconazole with other drug.